2024-2025 inaugural season of the WCEG network on the WCEG Talk Radio. We are the worldwide community empowerment group where we speak life to the community. I am Dr. Dolapo Babalola, physician and owner of Living at Your Finest Wellness, which is a membership-based, holistic, and integrative direct primary care in Marietta. It is my honor to be your show host for this evening's segment on the Holistic Perspective Show. We are here to enrich you, to inform you, and inspire you, right? So September is Perimenopausal Awareness Month. And one of the days in September was also Menopause World Day. So I thought it would be appropriate to talk about this. So all women, keep your ears open. And if you're a guy and you're listening, keep your ears open too, because this impacts you one way or the other. So the question for the segment today is, what stage are you in? So for our ladies, what stage of menopause or perimenopause, where are you exactly? So I want you to think about this as I go through this session. And I want you to also ask yourself, what are you doing about it? So my goal this evening is to discuss what menopause is and what is perimenopause, okay? Because the stats show that 90% of people just don't feel well informed. So we're going to talk about it. And we're going to talk about this weight gain that tends to occur during perimenopause, menopause. What are the other symptoms that occur? And we're going to talk about treatment, because not enough to just talk about what's going on, but how can we take care of it? And then I'll end with commonly asked questions. But I want you to tag your friends, your neighbors, tell them the show has begun. We want them to stay updated. We don't want them to miss a single thing. We are live on YouTube, Instagram, Facebook, just name it, and certainly the WCEG Talk Radio and app. All right, so go tell them we are live and we're beginning. But before I start, two quick announcements, all right? First one is that information that I share or any of the co-hosts shares is not necessarily the views of the organization. So be mindful of that. And also that even though I'm a physician, I am not your doctor. So I'm making general information. It's not specific to your own needs, all right? So with all of that, I guess we can get started. I like to start with a quote. And this one is, menopause is not the end. It is a new beginning. Embrace the changes and you will find strength within. I thought that was powerful. Yeah, so that is key. And with that, I want to start by sharing my screen. All right, so let's get to it. Let me share my screen so that we keep me on track and I'm a visual learner, and that way you get to see what I'm talking about. All right, let's see, make sure everyone can see that. All right, so important to start off with menstrual cycle. So what's this menstrual cycle? You see, God has blessed women with his menstrual cycle. Yeah, so we have birth, we have different stages. So before we get to menopause or perimenopause, we need to start from the origin, from the beginning. So birth, what happens at birth? You know, for our adolescents, what happens anywhere from 10 to 23, they begin to get into puberty, right? So the ovaries begins to release an egg, all in preparation for as they get older, right? To have a baby later in life. And then we have pre-menopause, which this is stages, your hormones are still stable. But when we get to perimenopause, this is anywhere from ideally 40 to 51. Some people say 45 to 55. Your hormones are all over the place. They're like roller coaster, doing gymnastics, flips, and all sorts of things. And I'll share a little bit about what that means. So your estrogen and your progesterone, those are the two big hormones in the ovary area. And then the FSH and LH are two hormones that are in the pituitary gland. So those are just hormones that control what goes on down here in the pelvic region. So perimenopause, that's what's happening. There's a roller coaster, as you can see. And then menopause is where everything like just fades down, right? So your estrogen is diminished significantly, and then you don't have all that roller coaster. So my question today is, what stage are you in? Okay, as you're listening, are you in the pre-menopause, perimenopause, or post-menopause? All right, stages of menstruation. You heard me talk about the FSH, and pretty much that just means the follicle stimulating hormone, and LH, which is the luteinizing hormone. Those are hormones that are in the brain that knows that it's time to signal the ovaries to produce estrogen so that we can build the egg. And so that's what you see in this diagram. A cycle is usually 28 days, right? So the first half of the cycle, there's the follicular stage, the egg is building, estrogen is building up, as you can see there. And then anywhere in the 14th day is where the egg is mature enough. And then the LH, which is the luteinizing hormone, now tells the egg, okay, drop now, go ahead, let's get this egg fertilized. And then that's where the progesterone comes in. And then if there's no fertilization of the egg, that's when we have our cycles, right? So I look at it as the womb crying. It's like, oh, there's no fertilized egg. I'm crying. It's shedding. So what is it shedding? It's shedding the house that was built preparing for a fertilized egg. But if that didn't happen, then it bleeds and it sheds. And then the cycle starts all over again. Okay, so as you can see, there's so many hormones that go back and forth, back and forth. So this is a picture, a diagram of some of the symptoms that one can have during this period, during this different stages of life. I don't know if some of the women listening, maybe before your cycle, you might feel a little bloated. Sometimes you might feel a little energized. So it just really depends on what hormones you have that are at its highest peak. And perimenopause, you start hearing about hot flashes, night sweats, not sleeping properly. There's a lot of things that go on just because of the hormones. But the thing is that once we armed with knowledge, we can use that knowledge to help us and maximize and optimize the way we feel. So this diagram just shares what's going on with the hormones. Again, just an illustration of what I spoke about early on. Now that I've talked about the different stages of our menstrual cycle, now let's talk about menopause. So menopause comes in 3 main stages: the perimenopause, menopause, and postmenopause. And as you can see in this diagram, it's just really similar to what I shared early on. The perimenopause occurs anywhere from 4 to 8 years before you see your last menstrual cycle. Seriously, it could take that long. And menopause itself is 12 months. You've not seen a cycle, no bleeding, you're menopause. And menopause is really just one day. So let's say you've stopped bleeding for 9 months or 10 months, and all of a sudden in the 11th month, you started bleeding again. You have to start counting all over again. I know it sounds crazy, but that's just what we have to deal with. And postmenopause is what happens afterwards. Your estrogen has just, it's leveled up. So what are some of the symptoms that people experience? It is so many symptoms. So I want to empower you that when you go to your doctor and you're just feeling off, you're just not feeling yourself, don't accept it as normal. Yes, it's a transition and all of that, but you need to be heard. You need to be listened to, and you yourself need to be, knowledgeable about what symptoms you're having. These are the general symptoms: hot flashes, vaginal dryness, which comes from the estrogen. And we'll take a quiz towards the end so that you can kind of get an idea of which hormone causes which problem, so that you know which stage of your cycle you're finding that. This is a more illustrative diagram. The big thing is weight gain. It's called midlife spread that tends to happen for women. And there are reasons behind it. It's not just because women just sit down and eat all day and don't move enough. It's because of all the hormones and all the different shifts that is going on. There's hair loss, there's irritability, mood swing, yes, depression and anxiety, brittle nails. I know when my hair started thinning out, I was like, oh my goodness, what's going on? Insomnia is a big one, whether it's because of hot flashes, but there's also a lot of dizziness, headaches, difficulties concentrating, and brain fog. There's what they call menopause brain. Yeah, so these are symptoms. Stress incontinence is a big one because of estrogen. Estrogen is that hormone that pops us up, that makes us glow, that strengthens our vitality, as well as testosterone, even though, yes, men have testosterone level at a higher level, but women, we also have some. So when these numbers are fluctuating and all over the place, you're going to have symptoms like as you see right here. So what are the main causes of weight gain during menopause? The 4 main causes will be certainly loss of muscle mass, right? Sleep disturbances, depression, anxiety, and insulin resistance. And I'm sure you've heard insulin resistance before. It's not unfamiliar. We have a lot of insulin resistance as we get older, right? Because our metabolism generally slows down. There's all that fluctuation. There's probably increased stress, or our insulin resistance becomes more heightened. So let's talk about a few of these hormones that play a role during menopause. So I said estrogen, the progesterone, testosterone, the LH, and FSH. Those are the big hormones. But what they do is they influence these things that you see right here. So even though, yes, when we were in school, we were taught not to check because they fluctuate all over the place, studies have since changed that depends on how you're feeling, what symptoms you're expressing. So number one, cortisol is the fight or flight hormone. And what happens as you know during more so during menopause, if our cortisol is increased, it increases fat storage, right? And unfortunately, it can decrease muscle mass. The ghrelin and leptin, those are hunger hormones. And what they do is, unfortunately, if we're not sleeping adequately, what happens is that there's a shift, there's an imbalance. So you're feeling hungry all the time, you're not feeling full enough. Those are the two hormones that increase hunger. Thyroid, a lot of people talk about the thyroid. It's my metabolism is slow, it's decreased. That also can be affected. There's weight gain or weight loss. And then back again to the insulin resistance. So now we want to talk about treatment. A lot of times people want to know, what are my treatment options? Certainly, this is one of them, the hormone replacement bioidentical hormones. This definitely plays a significant role in improving your just just the imbalance in your hormone settings, like the hot flashes, the night sweats. Studies have shown that it makes a significant difference. But before we get to this, which everybody always wants to jump to, hormones, let's take hormones. There are things that we can do in our lifestyle that certainly can help us before we get to this. This should usually be after you've done all the others to stabilize your hormones. So let's go through a few questionnaires just to kind of get an idea. So if you have low progesterone, this is how you would know. You would be having painful, you'll have headaches, swollen breath, irregular cycles, your sleep, that's a big one. Your sleep is just disrupted. And this has nothing to do with you scrolling on your phone or looking at your TV. You're just not sleeping well enough. That's because of progesterone. All right, let's look at estrogen. Estrogen is, again, dryness in the vagina area, bladder infections. I had a patient that was always UTIs after UTI. They're like, what in the world? Again, that's it, because the estrogen is decreased amount. So there's susceptibility to infection. So those are some of the symptoms one has. Certainly the night flashes, all of that, the wrinkles, because estrogen helps to boost. I mean, it really pops you up, like you can, as you can imagine. That's what feeds the uterus and gets it ready for a fertilized egg. So that's what estrogen is, the role. So in its absence, that's where you see a lot of all these things. Some things that you also see, especially in the menopause age, is bone loss. That's why they say when we're older, when we're in the menopause, we need to move. We have to stay active, move. Because if you don't move, your bones are going to become very fragile. You can fracture and break it, and you can fall and fracture your bone, and it's very difficult to heal because you don't have the estrogen that gives you the mass anymore. You lose bone mass. So there's all that takes place with low estrogen. Now, what about testosterone? So these are some of the things that happens if there's a low testosterone. I don't know if you can identify with any of this. The big one is loss of a libido. And I know we're talking about women today, but also the same thing happens with men. Libido, sex drive is decreased. You're just feeling really down, depressed. All of these are symptoms for low testosterone. Now, how do you know which one is? You certainly have to add all these numbers together to kind of get a sense of where you fall under all these things that I talked about. All right. So these are the things that I need you to be mindful of. Now, thyroid. How would you know your thyroid is low? Okay. So brittle nails, right? You just feel so all the time. You feel dry. Your skin is dry. You're always feeling there's the back and forth between hot or cold. You're very sensitive. You're always feeling cold. Those are the things. You're having swollen ankles, brittle nails, slow speech. You're constipated, regardless of how much you're eating, you're constipated. And even if you're eating very little, you gain a lot of weight. So those are some of the things for thyroid. There's much more, but those are the things I want you to be mindful of. Now, cortisol, how do you know if you're cortisol? Because remember I said cortisol is a big one in menopause. If we're overly stressed and our cortisol stays high, these are some of the questions. Sometimes you're feeling wired and tired. You just don't feel energized enough, or you just feel always down and you feel very, you just feel very distraught. Things also could be sugar craving. You're always craving sugar, you're gaining weight, your blood pressure is high, heart rate. So as you can see with all these symptoms, there some of them interlapse with each other, right? So that's why you definitely need to have that conversation with your primary care doctors, to sit down and figure out which one really is going on. And sometimes these might need to be complemented with blood work just to see where you are. So these are just general menopause questions that I'll go through. I'll just pass through now. And this is a beautiful picture of all the hormones that our bodies go through. So now that we've talked about all of this, let me share on how we can navigate, because that's the key thing. How do we navigate? So remember, the first thing I said is the four things, right? So sleep, we're having sleep issues, we're feeling depressed, we're losing muscle mass, and then certainly we're having just all the different hormones fluctuate. So let's start with treatment plan. So first treatment plan, before we even talk about hormones as an option, is certainly our nutrition. So nutrition plays a big role, not just for the depression part of it and then the brain fog. It also plays a role in managing our weight. So I put them in three categories. The first one is certainly nutrition, just lifestyle altogether. And lifestyle would include nutrition, it will include physical activity, it will include sleep. And then the second bucket will just be botanicals. I talk about botanicals a lot of the foods we eat, and the spices and the herbs, all of those make a big difference in how our body responds. And then certainly the third bucket will be the medications. And the medications could either come through by identical hormones or weight loss medication if that's necessary. So let's start with lifestyle. So lifestyle nutrition, again, it's so important that we minimize processed foods, because processed foods have a lot of hormone disruptors. All right. And our hormones are already all over the place. It's already like all over the place. So we have to be very mindful. If we're eating protein, animal products, we need to make sure that it's lean as possible, minimally processed. So all the foods that all those nitrites, all those hot dogs, all those things that have a lot of hormones pumped in them, you really want to cut back on these things. I know they taste sweet, good, but they do the body no good. That is my message. When you prioritize eating lean protein, then you can also stabilize your hormones, because your hormones are already doing what they're doing, and you don't want to make it worse. So you want to prioritize lean protein. You want to make sure that your protein is more plant protein. If you're eating animal protein, leaner the better, right? You also want to be very mindful of your portion size. Other things about nutrition is that you always want to have a balanced plate. I promise you, eating plant-based foods, more veggies in your plate, abundant veggies make a big difference. So we say go from the standard American diet, which is SAD, to the HAD diet, which is Happy American Diet. So you want to eat more veggies, more fruits, more beans, legumes, whole grains. That helps to stabilize your hormones. Even more than that, it helps with your gut health, right? So remember I said in menopause, there's that increased risk of brain fog, anxiety, depression, because of all the back and forth with the hormones fluctuating and doing roller coaster. If you eat a healthier, more rich food that feeds your gut health, then you're more likely to have that really good connection between the brain and the gut. If you feed your gut well, it's going to serve your brain properly. So that's about nutrition. Another thing with nutrition is what we take into our mouths, right? So alcohol is a big one. It doesn't serve our bodies well at all, especially during this stage. We have to cut back because the liver is processing, just the alcohol. And if it is overwhelmed, you're going to feel it in hot flashes and night sweats, all sorts of things happen. You're not sleeping well. Alcohol does affect your sleep indirectly. It might get you to sleep, but it doesn't keep you sleeping long, right? So that is so important that we have to pay attention to our nutrition. So that is big on nutrition. Now let's talk about physical activity. Physical activity is also one of those components on the lifestyle interventions. So physical activity is important because it increases your muscle mass. We're already losing muscle, right? As we age, we lose anywhere from 3 to 8%. When you start is 1 to 3, and as you get older, it begins to increase. So you certainly want to do some form of movement. Cardio is good, but most importantly, strength training. When you strength train, you use those muscle, right? And when you use the muscle, you maintain bone integrity and you increase your testosterone level. Did you know that just doing strength training allows you to increase your testosterone? Because as we get older, our ovaries that produces testosterone level is no longer producing it. So it's now taken over by the adrenal glands. So you want to do strength training. If nothing I say today resonates with you, please get some weight and just do, even if it's doing a commercial, just do some strength training, do some squats if you can, as much as you can, do some calf raises, just do things to stimulate your muscle. You see, I'm doing some calf raises. I mean, you could just do that like 3 times a day, do a set, but strength training is so important for women. I cannot overemphasize it because people fall, break their hip, and then it's all sorts of problems after that. So strength training is so important. You want to incorporate that into your activity. All right, so that's key. Other things I want to emphasize in just that lifestyle intervention is stress management. So stress management is important because of cortisol. Remember, I shared that cortisol is one of those hormones which can either make things better or make it worse. So cortisol, we really need to practice where our cortisol goes up and goes down, right? And not stay up continuously, right? So doing breath work matters a whole lot. Meditation, if you're a faith person, meditating on the word, being in company with people, social connections, meaningful connections, all of that matters. It helps to bring down your cortisol level, right? I always advocate for giving yourself a hug or hugging someone or smiling with people. There's just something about when you smile, when you dance, and when you're happy, it gives you good vibes, good hormones. But if you're always mad and you stay in a state of disgrunt, that's not helpful for your hormones. Your hormones are already doing its thing. You want to do things to make it easier on you, right? So stress management is so important. You want to limit your stress level. Sleep, I say that to the last because sleep, oh my gosh, there's so much I can say about sleep. When we sleep, they say if you do not snooze, you don't lose. Okay, let me say it again. If you do not snooze, you don't lose. And this is even more so important in the perimenopausal season. We need to sleep because if we don't sleep, our hormones are all over the place. The ghrelin, the hunger hormone, and the leptin, the satiety hormone. So if we're not sleeping, they're not in balance, right? Another thing that happens when we don't sleep, the growth hormone does not get activated. It doesn't come in and do the clean out, the washing, the repair, and we need that. So we need to make sure that if anything at all, the strength training, the sleep, we need to do our best to, even if it's at 30 more minutes, an hour, just to sleep so that we can regulate our hormones and then it minimizes all the impact that we get from the fluctuation. Okay, so we talked about nutrition, physical activity, stress management, and sleep. So those are key. Now let's talk about the botanicals. So botanicals, what does botanical means? It just really means things that we add like adaptogens, things, herbs and spices. There are a lot of them that have shown tons of benefits like lavender, ashwagandha, ginger, garlic, all those things help with just regulating our hormones. There's been some that have been evidence-based, that has been researched, some haven't, but some people swear by it that they work for them. So those are things you want to consider in your diet, right? I love turmeric. and I love black pepper. I always add it in anything I eat because it helps my body, it helps my bones, it helps my mood, right? Garlic, ginger. If you're not a spice person, please consider adding some spices into your diet. All right. So botanicals, there's so many more. I'm happy to share the link afterwards so that you can reference those. But certainly those are the things that you want to consider. Just adding more spices and herbs into your meals. There is the black cohosh that I know some people have used to help with hot flashes. I know some of my patients have used it and it's worked, but you want to talk to your own doctor to see if, there's a consideration, provided everything fits, you can use it. So there's so many things. There's John Warts. So there's so many things that people can use as botanicals and adaptogens. People talk about supplements to help: magnesium, lavender, zinc, all those things, vitamin C. I love lemons because lemon is an anti-inflammatory. It helps to regulate my inner temperature. So those are things that I call botanicals. Now, let's go to the last but not the least, and this comes in form of medications. So the first medication I want to talk about is certainly for weight gain. If there's significant amount of weight gain that has led to chronic diseases, like especially with insulin resistance, if nothing is done with insulin resistance, it can go from pre-diabetes to full-blown diabetes. All right, this is what studies have shown. So you don't want to sit on it. I had a patient last week that they sat on her A1C that was 6.1 for 3 years. Now she's like at 8. And she didn't know. They kept telling her numbers were fine. You're fine. You're okay. You're not diabetic yet. What were they waiting for? Were they waiting for her to be diabetic before they told her anything? Well, apparently that was the case. She went back and saw that her labs were actually high. I mean, they were pre-diabetic, but nothing was said to her then. Now, suddenly the argument was like, well, if they said anything to her, would she have changed her ways? Who knows? At least you gave her a chance and educate her about it. So certainly back to what I was saying, with the weight gain, there are some indications for weight loss medication. Again, remember, foundation is always lifestyle interventions, and that's what we all have to do continuously. It's not you start today and you stop. It's not an all or nothing. You put in the effort every day. Consistency is better than you're not striving for excellence. You're just trying to do it all the time. All right. So back to medications, weight loss medications. There's several weight loss medications out there, but the key thing is really honing on your lifestyle habits. So medications, if we're talking about the first generation medications, they could come in pills. But if we're talking about more of the second generation weight loss medications to help with menopause, depending on what other issues you have on, if you have diabetes or high cholesterol, those are considered comorbid issues, and that could be an indication for weight loss medication. So you do want to talk to your doctor to see if that would help you to lose the weight. And of course, if you lose the weight, then you feel more confident, you feel more energetic, you can move more. So it's a good cycle. If you feel good, you're able to exercise, and then you're able to do more things. And so weight loss medications definitely do have their place. All right, it's just finding the right one for you. And other than weight loss medication, based on all the symptoms that I explained with menopause, that can go all the way from vagina dryness to urinary incontinence to stress incontinence, all those things that come along with weight gain. Certainly the hormone replacement therapies, the bioidenticals, those are the ones that are not synthetic. The synthetic, unfortunately, have gotten a bad rap with all the complications that come about with menopause, especially if you have your uterus and you're on hormones, synthetic hormone replacement medications. There's been risk of breast cancer or uterine cancer and things like that. So leaning more towards the bioidenticals, and just means something that is more natural, that is more natural to what your body can tolerate. So that's the bioidentical. So you definitely need to speak very closely to your doctor to see which one will be the best match for you. Now, I want to take a minute now and talk about some complications that naturally occur with women when we hit menopause, and we need to be aware of those because the estrogen is no longer there. Remember, I said once we hit menopause and the estrogen is just like, it's going like this, perimenopause. But when you get to menopause, it just goes down, it's just low, right? So what happens then is that women, we're now at risk for strokes. We're now at risk for heart attacks. We're now at risk for osteoporosis, thinning of the bone. We're at risk for all these other things that unfortunately was holding on to the estrogen that was protecting us. I know it's just very mysterious the way things work, right? You feel like you can never catch a break with women, but there's hope, right? It's just once we know how our body works, then we can arm it with the ammunition to work in our favor. So back to what I was saying. So those risk increases as you get to menopause. So we have to be mindful. That's why we have to make sure the lifestyle interventions are on part. That's why we need to make sure that we're optimizing our diets, our sleep, and all those things that would help to protect us from missing the estrogen. Now, if we're deciding that yes, I want some hormones, you have to find the right one for you. The bioidenticals come in cream, they come in patches, they come in tablets, but you want to make sure you get the right one, and you need to be monitored closely, because that is like a tank that is empty and you just want to put a little gas in your tank so your car can move a little bit more. So that's how it is with the bioidentical hormones, right? So somebody that says they'll have a lot of vagina dryness and they just have low libido, and then you check and you see the testosterone level is low, that is somebody that could make do with an estrogen cream or a testosterone if the testosterone is low, to put them up to make them feel like themselves again. So those are the people that would need that, and science and evidence behind scientific evidence shows that it is helpful for some women. So it's just really trying to make sure which one is the best option. And the bioidentical hormones, they come in estrogen and progesterone, and there's the testosterone. Those are the three main ones. And more than those, but those are the ones that I want to mention. So a lot of information, a lot of information to digest. I want to now go to commonly asked questions. Let me pull up questions that come up quite a bit. Let's see. Okay, so I'm going to once again share my screen, and certainly I'm happy to answer any questions that people might have, but let me pull up commonly asked questions. All right. So one that comes to mind is, when can I start hormone replacement therapy? Well, the recommendation is, as I mentioned, perimenopause starts very early. Some people as early as 30s, in your 30s, seriously. And because the symptoms are so numerous, you really are not sure where you are. You're like, is this menopause? What is going on? You're not sure. So that's why you want to take the quiz to see which one you really fall into. But in terms of studies showing, I mean, you can start as early as the perimenopause, depending on the symptoms you're trying to address, right? So you can start at that time. Another question that tends to come up, am I going to take this lifelong? When it comes to answering questions about should I take something lifelong, I usually just say take it one day at a time and see how you feel, right? We tend to ask this question about lifelong, and I know we like to project into the future, but I like to just be present and take it one day at a time and see how you go. And sometimes some people are, and some people don't need to. If your body adjusts, everybody's situation is different and unique. So that's how I usually respond to that question. Another question is, how can my family and friends support me through my transition to menopause? That's why I told the men, and I hope men are listening, that your daughters, your wives, your partners, they need the support, because it's a real thing. It is a real thing. The body is going through a lot. And women, we're very, how do I say, we can take a lot. We're very resilient, and our bodies just go through a lot, but yet we still keep moving. We still keep getting things done. So we definitely need all the support, right? Just support them, understand, and don't minimize it, right? So that's how I would say you can support. Just be aware of what's going on and show support and grace. All right. Question about vagina dryness. Yes, menopause causes vagina dryness because the vagina is lubricated by estrogen. And if that estrogen is lost, then there's thinning and dryness. And of course, any form of sexual encounter could be very painful. So you want to be mindful of that. Again, the creams, some people use the lubricant, but if you have multiple symptoms, you want to address a lubricant. It's not going to take care of that. Like if there's hot flashes and there is dryness, a lubricant or over the counter is not going to take care of all those things. So you want to kill several birds with one stone. You want to talk to your healthcare provider to give you a good choice that will cover those. But certainly an estrogen cream can help. Let's see, things to help with hot flashes. Certainly, if you don't want to go the hormone route or other medications, there are medications other than hormone replacement therapy, by the way, that have off-label to help with hot flashes. But if you don't want to do meds at all, it's certainly making sure, like all the things I said in your food, what to eat, how to eat it, right? Alcohol is a big one. Stress is a big one. Definitely making sure that the room is cool, right? Your blankets are lighter, all those things. You want to be very mindful. Oh, something I didn't mention for vagina dryness, vitamin E is very good. Vitamin E, it helps to lubricate. So the oil. Yeah. All right, let's see. Any more questions? Okay, so what tests should we do? What tests should be done usually during menopause, perimenopause? So again, when it comes to testing, I must tell you, it's a controversial topic because generally in school we were taught because of all the fluctuation that there's no point checking. But we have since seen that there's a particular time that you don't get much fluctuation, and that's when people tend to want to check just to kind of get an idea of where they are. And that's usually anywhere from day 19 to 21. That if you are cycling, that's the best time to have those blood work checked. And if you're postmenopausal, it doesn't matter. You're not all over the place. If you can remember the picture I showed you, you're not like roller coasting or doing gymnastics. So postmenopausal, you can just check anytime. But if you're cycling, you check mostly your cycle day 19 to 21. Okay. But talk to your doctor to have that conversation to see if you're a candidate for that. All right, a good question that comes up quite a bit is urinary incontinence. And what does that mean? That means, oh yeah, you can't get to the bathroom quick enough and you're peeing on yourself, or you're leaking, like they might say. Or maybe you cough and well, that is not an uncommon symptom for women, especially when you've birthed a child, your pelvic wall that was supported so well, it's loose now. So you definitely want to decrease anything that increases intra-abdominal pressure. But Kegel exercise is a good one. If you're not familiar with Kegel exercises, you're strengthening that pelvic wall. So that's one thing for sure. And then estrogen has been shown in some women, especially those that have, a lot of frequency and a lot of affinity for UTIs, urinary tract infection. So, a hormone replacement therapy can help, whether it's a cream. So those things definitely help. But key thing is pelvic wall. You might need to go to a pelvic wall therapist that will help you with that. Okay. So I think I pretty much answered all the questions. Let's see, I think I might have one more. Okay. Yeah, very good. So is it true that some hormone replacement meds can cause other underlying issues? Well, that's a great question, and thank you for that question. Yeah, so everything is not without one side effect or the other. I can tell you that the bioidentical, which is what I prescribe in my practice, they do more good than any harm at all. And if I am prescribing it for a patient that has a uterus, I always make sure that I prescribe a progesterone because that protects the lining. So if you remember, I shared the way the body is designed, right? Estrogen is what pops us up, which gives us the glow, the vibrancy, and all of that. And it also prepares the uterus, right? It like like Thanksgiving is coming, you stock the house with food, you get it ready for your guest that is coming to eat. That's what estrogen does. But then after your guest has left, you purge out all the things that you don't want. So that is so whenever we give hormone replacement, more of the synthetic, the one that your body naturally recognizes, it is going to do that, but you don't want it to keep doing that and filling it up, because that's where cancer can come in. That's where we have endometrial cancer, we have endometrial hyperplasia. So that's why you want to give, especially if you're taking it by mouth, you want to give a progesterone, because a progesterone will prevent it from being too thick and all those tendencies for other things to come up. But yes, it's a major valid concern that people have about taking hormone. Now, again, I want you to be very mindful. I'm talking about two different, the hormones that we used to take then, birth controls. There's been lots of studies. There was a study that was sponsored by the NIH that, if you guys remember that study, where there was a lot of controversy and all the complications that people had, was just because there were synthetic hormones. But these bioidenticals, they're more of your body's naturally blend properly. And as long as it's prescribed properly and you're monitored, it doesn't have all those complications that we saw with the other medications. So yeah, those are the things I definitely want to emphasize. But this is a broad topic, so certainly it's not one that one can cover during this session, but I just wanted to kind of touch up on it and emphasize that the main things that tend to happen with menopause, perimenopause, for this transition, a smooth transition, you need to be mindful of peri, which happens before menopause, and it's anywhere from 4 to 8 years before your last menstrual cycle. Menopause is 1 day, you hit it, 12 months, no more cycle, boom, you're good. You're post-menopause now, and post-menopause means your estrogen is completely flatlined, right? So what things do you need to incorporate into your life to replace those actions, right? And help you live at your optimal well-being. And certainly you need to be mindful of some of those symptoms that come about from having fluctuating estrogen as well as low estrogen. All right. So very good, very good. So thank you all for your attention. I appreciate it. I am Dr. Babs, the host for the Holistic Perspective Show. Thanks for joining and being part of this month where we talk about Perimenopausal Awareness Month, navigating the menopause phase in a smooth transition. And the question again is, what stage are you at? I hope you asked yourself, where are you? Are you pre-menopause or peri or menopause or post? And whichever stage you're at, what are you doing about it? How are you optimizing your health and well-being? All right. So with insight, we can empower ourselves to live healthy lives, right? Because we certainly deserve it. I always like to leave with a nugget, and this one is really, really cool. I like this one. It says the perimenopause symptoms can be managed by making lifestyle changes. Think of the symptoms as your body's way of crying out for love, help, and attention. All right. And this is by Tennant Lee. So thank you so much for joining the inaugural session of our Holistic Perspective. I hope that you will take one, two things, share this episode with your friends, your neighbors, and let's all feel empowered. So until next month, I want you to take care and God bless.